Hi, I'm Dr. Sheehan from Sheehan Natural Health Improvement Center, and this is, I think, about the fifth or sixth video in our lab testing series, and it's on vitamin D. Everybody knows about vitamin D now. Since COVID, we have heard a lot of people say that it helps with COVID. What I will tell you this, quick little fact here, is we started doing blood testing years ago, and what we found was that in the winter months, ask yourself, what percentage of people do you think have optimum levels of vitamin D without supplementation? Okay, what level of people do you think that during the winter months have optimum levels of vitamin D without supplementation? Okay, if you guess 0, you were right. I have never seen somebody that during the winter months that does not supplement that has adequate levels of vitamin D. It is very, very important. Vitamin D, let's see what the signs and symptoms of vitamin D here. Oh, no, we don't have it. But the big thing is right now in the press is immune system weaknesses or immune system issues. You're also going to see weakness. A lot of people will come in, they'll have low back pain because they have weak low backs. You will see dental issues because it alters the calcium, magnesium, phosphorus ratios. You can see a lot of hypertension. People can have high blood pressure, and vitamin D deficiency is part of it. A lot of pain. I'm a chiropractor by that's the first. That was my I guess that was my second degree, but that was my primary profession. And then I started doing a lot of nutritional counseling, and it's because of the fact that I found that a lot of people had chronic pain and they weren't getting better with just chiropractic, and vitamin D, low vitamin D, contributes to chronic pain. Also, a lot of depression. Vitamin D is also a hormone, and it helps with your hormonal balance. It doesn't mean that more is better. It means that more optimum levels is better, it's better. And so you can see it linked with depression. Notice I'm not saying this causes. There are links though, okay? And also blood sugar issues. Fasting blood sugar, fasting insulin, which is, if you want to look at our blood sugar video, it's very, very important to get your fasting insulin checked. They are inversely related to vitamin D. So in other words, the higher your blood sugar, higher fasting insulin, the lower vitamin D tends to be, okay? What to look for? We just test for on our blood test, vitamin D, 25 hydroxy, 35, and it should be 35 to 60 nanograms per milliliter, okay? Right now, some functional medicine doctors like to have it 80 to 100. There's also evidence that, that you don't want to go that high. A safe dosage is 35 to 60, okay? So just keep that in mind. And you can just get this, we'll have a link down below about how to get these tests. You can go to your functional medicine doctor, you can go to any lab test now, you can go to Quest, you can go to, we use LabCorp, and we have what's called a co-op, professional co-op, and you can test for that, okay? What do we do to improve vitamin D markers? Well, first of all, if you look back, you can look at what's called the PAGE diet, video. We put people on the PAGE diet. We put people on PAGE phase 1 if they have a blood sugar problem, PAGE phase 2 if they don't have a blood sugar problem, but refer to that video. So we handle that, and basically a diet that is primarily protein, meat, fish, chicken, eggs, stuff like that, along with lots and lots and lots and lots and lots of vegetables. In other words, like 3 times as much vegetables as protein. So lots of vegetables and protein, small amounts of fruit, small amounts of fermented grains and legumes and stuff like that. So we put people on that, and then there's a vitamin D point on the body. We do muscle testing called nutrition response testing. And there's a vitamin D point, which is by where the right clavicle joins the sternum, okay, and we test that. And from Standard Process, they have a supplement called Cataplex D. They also have cod liver oil. This is the original formula of how our body would actually absorb vitamin D, because it comes from fish, cod liver oil. And so Royal Lee, the genius behind Standard Process, he came up with these formulas. We use another company called Systemic Formulas, and they have what's called vitamin D3 liquid. Use that a lot. Tastes really good. Tastes like Tang. You put it in water. Very good. And also we use something called Energetics. Energetic is primarily a homeopathic company, and they have something called D3K2 spray. What I will tell you is that right now, the reason, if you notice, Cataplex D has D and A, vitamin D and vitamin A. Systemic formulas has D, K, vitamin K and A, and energetics has D, K, and A. Okay, in nature, our body absorbs these three vitamins together, D, K, and A. Now, I will tell you that originally, Cataplex D was made by Royal Lee, and I can tell you that if you give people Cataplex D, their vitamin D levels in their blood goes up, so it works. It does not have the K. You're going to have to get the K from your vegetables for that. It's not as effective as getting it from fermented foods, and the K in systemic formulas and energetics is in that formula. I will tell you though, I use all three formulas. They work, people feel better, and their blood levels go up. Okay, so that's how we handle low vitamin D. Any questions on that, Jen?